Hi everyone, my name is Aliese, and I'm the Senior Program Manager for ODMAP. And today we're going to talk about using technology to harness data, accelerate action, and save lives. And this will be focused on obviously using ODMAP combined with collaborative and diverse partnerships. And so much what we're going to be talking about is collaboration and spanning multiple different agencies, multiple different types of disciplines to be able to develop partnerships and collaboration both with data and actual strategy outside of ODMAP to further putting data into action. So for those of you that may be a little unfamiliar with ODMAP or it's been a little bit since you heard about it, I wanted to take the opportunity to do a brief overview of how ODMAP came to be. So ODMAP was developed in fall of 2016. At that time, our executive director of the Washington-Baltimore HIDA, Tom Carr. And so I'll pause there to talk a little bit about the HIDA program before we move forward. So the HIDA program is a program that's administered through the Office of National Drug Control Policy. There's a little over 30 HIDAs nationally. Each HIDA serves a direct area of responsibility. So our HIDA is the Washington-Baltimore HIDA, and we serve Maryland, DC, Virginia, and the Eastern Panhandle of West Virginia. And so the HIDAs, they work together to bring together law enforcement ranging from local, state, and federal to bring them together to foster an environment to collaborate and share information. And then some of the HIDAs, such as ours, receive dollars that we're able to put back out in the form of treatment and prevention. So at that time, Tom Carr, our executive director, was at a meeting in Baltimore. And you'll also take a moment to pause. You'll see the University of Baltimore on a lot of our presentations, such as this one. So being that the HIDA program is a program and we're not an agency, each HIDA establishes fiduciaries. And so one of our fiduciaries is the University of Baltimore. We sit within the Center for Drug Policy and Enforcement. So going back to the history on ODMAP, so at that time, Tom was at a meeting in Baltimore. It ranged from attendees having backgrounds of law enforcement, public safety, health, criminal justice, etc. And that was a time when fentanyl was really prevalent in Baltimore and on much of the East Coast. And so conversations were being had about the current opioid epidemic. And so there were several realizations at that point. The first was, you know what, as a nation, as a state, we're pretty good at tracking our fatal overdoses. There's a little bit of a lag there. But nothing was being done to capture non-fatal reporting, which is just as important as fatal reporting and serves as a logical intervention point. There was also insufficient information sharing. So for example, maybe information sharing was only occurring with an agency, but not with a partner agency, or information sharing wasn't occurring outside of a county or a region, and drugs don't discriminate. So it's really important that we develop something where we could share information beyond those common jurisdictional boundaries. There was also conversations that law enforcement, fire, EMS, etc., hospital visits would look back and say, wow, we had an abnormal number of calls for service or visits, last Wednesday. And that's kind of where that conversation started and stopped. And so we said, okay, well, what if we could develop something where people, first responders, public health, public safety, could respond to a spike as it's occurring. And then the last thing was we needed to make something that was equitable, that could be scaled in any community regardless of what financial resources were. So we needed to make something that was free. And so ODMAP just continued to march on from there. In January 2017, ODMAP was piloted in areas of West Virginia and Maryland, and then shortly became available nationally in April 2017 due to the feedback that we received in the pilot. And since then, a lot has happened. And the biggest thing that you'll notice about ODMAP is that it's simple, and being that it's simple, how it looks, depending on where you are, is going to be a little bit different. So being that it's simple and flexible, it can be scaled depending on what demand is, what the actual need is in a community. So in June 2017, Florida was the first state to pass legislation for ODMAP. And in that legislation, it basically gave EMS providers a conduit to report overdose data to the state. And since then, Florida's really developed, and there's now a statewide EMS API, which we'll talk about. But basically, statewide EMS data for Florida is coming over to ODMAP. Shortly, about a little less than a year later, Maryland enacted legislation, and Maryland was actually the first state to send over statewide EMS data. Since then, you can see a lot has happened. I'm going to pick out some of the milestones here. But in spring 2019, BJA, the Bureau of Justice Assistance, which is through the Department of Justice, funds ODMAP to further support and expand its reach. And then shortly after that, really around the same time, BJA, in collaboration with CDC, announced the ODMAP Statewide Expansion and Response Grant. And that was announced and awarded in September 2019. So 8 states that you see on the screen, they were awarded that grant, and so they're active in their implementation of working to implement ODMAP statewide in their respective states. And then the current national reach of ODMAP is over 3,100 participating agencies. We're at almost 30,000 users. Unfortunately, over 284,000 suspected overdoses have been entered, and over 50 agencies are utilizing the API, which we'll talk about, but it's, they're just basically connecting their record management systems to ODMAP, and the data is coming over seamlessly. So if you're not familiar with how data entry occurs at the manual level, we'll focus on that first. So on the left-hand side is the actual interface. And this can be accessed anywhere that you have internet connectivity. It can be accessed on a mobile phone, a tablet in the back of a medic, an MDT in a patrol car, or a desktop back at a physical location. And there's very few minimum required fields. So if you're looking at the screen right now, everything in case information is optional. So the required fields are a location. Most of our users are utilizing an address. And basically what happens is you type in the address, and then our geocoder will geocode it. The address is discarded from the system, and the user is not able to access it again, and you're provided with an approximated latitude and longitude. Then you just click one of those buttons down there at the bottom, which is basically just selecting the fatality status and the naloxone administration. It takes you to a screen, and then you verify the date and time. So it's always an important point when we're talking about data entry to talk about what is the data. So it's suspected overdose data. So what this means is that this is being completed in near real time. So it's after a first responder, a medical examiner, a coroner, somebody in a hospital in the ED, based off of their training and experience, and most of the data is coming from first responders. So based off of their training and experience combined with how the person was presenting themselves, that they believe that this was an overdose. So since we don't have toxicology back or crime lab back immediately, we say suspected. So there's also a method for data to come over via an API, which I've kind of alluded to. So an API stands for an application programming interface. And basically what that means is it can happen for a data transfer at a state level or an agency level. So for example, for a state level, a lot of states have centralized reporting, meaning that when we look at EMS, that the local EMS providers, once they submit a patient care record, it goes to the state. So there's basically a cloud of data that's already existing for all the state EMS data, and basically ODMAP and that record management system are always talking. So as soon as a patient care record is submitted, it comes over to ODMAP. And that can happen at an agency level too, which is currently happening in ODMAP. So for law enforcement, for coroners, for fire EMS, for your local record management system, where the data is already existing, you can just connect and send it over. And so that's the growing preferred method, just because it lowers the burden and increases the utility. But many times people just start with the manual entry as they're trying to figure out the best strategy and framework to implement ODMAP where they are. So we've talked a little bit about how data actually gets into the system, and so this is what it looks like when it populates visually. So we don't have a full capture here of the national map, but on the right-hand side where you see the ODMAP logo over the map, so that kind of gives you an idea of what it would look like from a national picture. But on the left-hand side, we have a legend. Diamonds represent fatal overdoses, and circles represent suspected non-fatal overdoses. And then the colors correspond with the naloxone administration. This is an overdose from our training environment, but it kind of gives you an idea of, number one, how far in you can zoom. So that's as far in as we're able to zoom. And then number two, what it looks like when you actually click on the overdose. So you're able to see the incident type, when it occurred. You're able to see the county and the state, zip code. But most importantly, you're able to see which agency entered that in, and then who at that agency is responsible for submitting the data. What you're not able to see on the screen is all the filtering that you can do in level 2. So you can actually sort the data by state, by county, by time frame, by basically any field that's available in ODMAP. You're able to filter it here in level 2. This is also a great opportunity to talk about data sharing and governance. Sharing information in ODMAP works basically that when an agency comes on board, they sign a participation agreement. And what that participation agreement states, in short, is that the data that you enter belongs to your agency. Your agency owns the data that is submitted. Us at the ODMAP program office, we are data stewards. So you are able to view national data. So there's some restrictions with that. Most biggest one is that you can't just take a screenshot of the national map and send it off to somebody in your community. You need permission from every agency that has submitted data to be able to disseminate anything visually from ODMAP. Our nation currently is facing 2 concurrent national public health emergencies. We have the COVID-19 pandemic and we have the opioid epidemic. And so we already had overlays built into ODMAP, but with the emergence of these 2 national public health emergencies, now more than ever, we have found that users have been using these overlays. So I'm going to talk through them a little bit, but we do, if this is something that interests you and you want more information about, we do have a YouTube series. So you're able to see kind of what those videos look like, but it's starting from a basic way to use overlays to expanding it to a multiple layer analysis and importing and all that good stuff. But basically how it works is you're able to overlay data in ODMAP, which has been really helpful for ODMAP stakeholders when we talk about the current environment, because you're able to see if geospatially, so spatially, if areas within your community that are most impacted by COVID, are they also most impacted by the overdose epidemic? That can really help you tailor the proper resources strategically on where they should go. And also, if you do have one area that is experiencing, abnormal numbers of both, again, being able to give perhaps priority to them. But the way that it works is that you can overlay open source data. So our platform, ODMAP, is built and powered by Esri. So you can actually just click on, right up there you see next to the bookmark, the icon next to that is actually an add data feature. And you click on that and you can search any publicly available layers. So for example, the COVID-19 layers produced by Johns Hopkins is in there. And then your state or your county may have quite a few different layers in there pertaining to things surrounding, population, economic factors, all that stuff could be in there. But you can also upload data that is just, unique to your agency. So for example, if you had, treatment and prevention resources that you wanted to be able to plot on the map to see if they are currently corresponding with where overdoses are occurring, or do you need to add more? So you can do that. So you can upload KML and CSV files as well that aren't open source, that are specific to your agency, and they can help form and inform your policies and strategies as everything continues to unfold and evolve. So there's quite a few statewide implementation models. So I wanted to at least talk about one, and I'll talk about another a little bit later just to give some context, because you'll find that everything is different, because what makes the most sense for Maryland may not make the most sense for Florida. So in Maryland, just prior to legislation being passed, in the fall of 2017, the Maryland Attorney General's Office released a memo supporting ODMAP, noting that ODMAP does not violate HIPAA. So if HIPAA is something that concerns you or you would just like more information on, we actually have a really long and robust document that was put together by our partners at LAPA and an ODMAP working group from ODMAP stakeholders from across the country. And so you can go to odmap.org and click on training, and it's right under there. And then in April 2018, Governor Hogan approved the bill that went forward, and basically it authorized EMS providers and law enforcement to report overdoses within 24 hours to ODMAP. And so this is an excerpt from a newsletter from the Maryland Institute of EMS Services, where they're talking about ODMAP, and I kind of just highlighted their data definition. Because one of the most difficult things with utilizing record management systems and finding a way to get the data over to ODMAP is utilizing, when you talk about EMS, NMSIS data fields combined with perhaps native record management data fields. For example, some vendors may have an overdose surveillance form, so you're able to combine not only NMSIS fields, but also fields that are captured within that form to help form your definition. So for Maryland, they're looking at naloxone administration, and then looking at the EMS primary impression is opioid overdose or substance overdose, or that EMS service provided yes to the question, did you suspect an opioid overdose? And then there's also, to complete the full circle of data within ODMAP, is there's a heroin coordinator program in Maryland. And basically there are individuals, they're called heroin coordinators, and they're assigned to either a county or several counties within Maryland. And they are responsible for entering law enforcement data. So they're able to enter law enforcement responded overdoses into ODMAP. And then if you're ever curious about what ODMAP looks like in your state or county, this screenshot is from odmap.org, and you can actually click your state or county. It's interactive, and you can see who's responding. And then this is just a recap again of what the current reach is nationally. So we've talked a little bit about statewide implementation. So this is a highlight of states that are active. And so there's also some that aren't on here that are currently underway. But the states highlighted in yellow, those states are states that either have legislation, executive order, policy or direction to either implement or encourage a statewide implementation. And then the states highlighted in white are those 8 states that were selected for the ODMAP statewide expansion and response grant. So now we're going to transition a little bit to, now that this has either been an introduction or a refresh or recap on ODMAP, to transition to some best practices and case studies. So we've been working with Erie, New York for almost 3 years now. So it's been really interesting and informative to watch their strategy evolve and change, and really to also see the impact. So for them, the Cheektowaga Police Department is within Erie County, and they are responding to a large number of the overdoses, either with EMS or perhaps they get there first, so they're carrying naloxone. So when an officer responds to a suspected overdose, they leave this packet right here. And inside of it has information on treatment and prevention, and they're also letting them know that a peer recovery coach will be contacting them. So you're probably wondering, well, how are they able to get that information about the individual since it's not an ODMAP? So they've developed a really innovative strategy. They do talk about it on a video that we host on our website. So this is Assistant Chief Brian Gould and then Cheryl Moore, who works at the Erie County Health Department. So there's a link on our website or YouTube if you want to take a look at it for more information. But basically, Cheryl and the folks at the Erie County Health Department, they use those filters in ODMAP on the national map, and so they filter down by New York and Erie in the last 24 hours. And when they see that a new overdose has occurred, they have a standing memorandum of understanding with the police department. And so they just email the records department and ask for a copy of the police report for the suspected overdose that occurred yesterday in the area of Main and 2nd. And so then they get the police report, and then the peer recovery coach contacts them by phone. And over the past couple of years, their overdoses have declined significantly. They're still evaluating how COVID has affected that, as they are seeing an increase. But prior to the COVID-19 pandemic, they were seeing a drastic decrease in both fatal and non-fatal overdoses. So this is another statewide example. So this is from Connecticut. All of this is it's publicly available. So if you want to look more at this, or you want to learn more about Connecticut in general, you can just type in the Connecticut EMS SWORD, and SWORD stands for the Statewide Opioid Reporting Directive. So every month they put out a newsletter. And so this data that you see is from ODMAP on the right-hand side there. And basically they have a strategy that when a first responder and even a bystander in the state of Connecticut administers naloxone or responds to an overdose, they call it into the Connecticut Poison Control Center. So you can see here that they're able to put that data back out to the public to help inform them. So this is a really recent press release from Shelby County, Tennessee, which is in the Memphis, Tennessee area. We've worked really closely with Shelby over the past year or two. And there's more from Shelby actually on our website, where there's a video from David and Courtney at the Shelby County Health Department talking about their strategy. But basically, Shelby County uses a ODMAP generated spike alert. And so in ODMAP, there's a feature that's called a spike alert. And basically what it does is it takes a look at data for a rolling 24-hour time period for a state and county. It looks at data for the past 90 days, or however much data is there if it's less than 90 days, and applies 2 standard deviations above the mean to determine a spike. You can also set your own threshold. But basically what will happen is the spike alert, you set up a bunch of email addresses that you want it to go out to. So a lot of times we see like a multidisciplinary email chain, from fire and EMS, police, DAs, hospitals, whoever. And it will say, hey, Shelby County's Tennessee is in a spike. There have been 10 overdoses in the past 24 hours. Your threshold is at 9. And basically it will keep alerting you as overdoses continue to increase, if they do. So it'd say, Shelby County, Tennessee is still in a spike. And then ultimately, once you get back to that threshold of 9, less than what you determined, it will say the spike alert in Shelby County, Tennessee has ended. So they've been putting out some press releases here, which if you just go to, Shelby County, Tennessee Health Department, it will take you there and you can see some of them. But spike alerts are definitely a method where we have seen stakeholders set up a framework of different levels of thresholds and what they mean. So, the first level could be convening of a multidisciplinary team. The second one could be going out and targeting, harm reduction into those areas. And the third one could be informing the public. It just depends on what makes the most sense. But another way that a spike alert can be utilized is to trigger a overdose response team or quick response team. So here's an example here from Oneida County, which is in New York. And so this is information that they put out after they identified a spike using ODMAP. So now I wanted to transition a little bit to our analyses that we've completed while our nation has faced two concurrent national public health emergencies. Because we were contacted by ODMAP stakeholders, by federal partners, by the public, wanting to know what are you seeing, but also wanting to know, hey, how can we perform analyses with our ODMAP data? And so some of the things, once we actually started getting into the analyses, is some of the challenges that were associated with completing it. So the first one being that many state and local governments have never captured non-fatal suspected overdose data previously, so it makes it really hard to do a comparison. Traditionally, you would want to look at non-fatal overdose data for May 2020 and then look at it for May 2019. But in many cases, you're not able to do that. Drug trends are continually evolving, and the rapid introduction of synthetic analogs can kind of complicate the use of historical data as a predictor for future overdose data trends. And then for ODMAP, we actually defer to state and local agencies in the definition of suspected overdose, just because of, when you look at especially like record management systems, it would be really difficult to be able to streamline that. But due to those variations, this definition has the potential to impact data consistency across jurisdictional boundaries. From a national perspective, some participating regions either aren't reporting or they're inconsistent in their reporting. And then obviously we just don't know the impact of COVID-19 because of it's still evolving. And then most importantly, from anything that we show here, correlation does not imply causation. So our first analysis was in May 2020. And what we were trying to do was to see if overdoses have increased since the onset of COVID-19. So we were trying to think of a way to do that given all of those challenges that I just mentioned. And so we utilize the autoregressive integrated moving average model, which has been utilized previously to actually forecast COVID-19, evaluate infectious and non-infectious disease, and even to identify and estimate significant clusters in overdose surveillance. So basically, we were able to normalize the data with all of those challenges, and here's what it produced. So the black line, you're looking at historical ODMAP data. The green line, or the bolded line after the black line, shows what the model would have predicted submissions to be based off of historic data. And then the dotted line, or the red line, is what actual submissions were. So we found that they were much higher than what would have been predicted. So then to further our analysis, a few weeks later we put this out, and these are both publicly available. So the links are down at the bottom of the page here if you want to read them more in depth. But we wanted to look at, as we were talking to stakeholders, we heard overwhelming reports that they started to see increases in overdoses in March, April, May. So we started to think, okay, what was significant in March, April, May? And so the implementation of state-mandated stay-at-home orders was the most significant, with the first one going into effect in about mid-March. So we were finding a way to basically take a look at the data. And so we have a partnership with the Johns Hopkins Applied Physics Lab And there's a program out there called SAT-SCAN. And we specifically utilize the space-time permutation model, which basically looks for anomalous clusters of suspected overdoses, both spatially, so for a location or geography, but also temporal or time. So as we were looking into them, we found that there were anomalous clusters. So, and what that means is that the system took a look at them and found clusters that it would not have expected to observe. And so you can see here that on average, the observed clusters contain 6 more overdose emissions than what the model would have expected to observe. And so this is a redacted diagram, but this is really what it showed, is that those areas bolded are cities, and that the models in many cases showed that they were moving and migrating to more suburban and rural areas. So you're probably wondering, well, what does that mean? So again, the United States is facing 2 concurrent national public health emergencies. This is a really rare occurrence, combined with how rapid the qualitative and quantitative factors are. There could be many conclusions for these findings. So some things that we believe could be contributing to them are the lack of non-fatal historical data, which we talked about. Naloxone has been deployed at rapid rates to non-medical staff. So a bystander may be administering naloxone, it may not be reported. So it's sometimes difficult to maybe understand the true reach of the overdose epidemic. Seasonality, infectious and non-infectious diseases are pretty synonymous with time, when you look at the flu. And so seasonality with overdoses is still not, the full impact isn't really known, just because of all the data challenges that we talked about. Also, the state of our economy and unemployment rates. Recent research has found that associations between unemployment or non-labor participation and the risk of drug overdose. So it's difficult to know what that reach would be. And then we talked a little bit about the evolution of trends and how this can be difficult. One of the biggest things, or potentially one of the biggest things, is that there's no antidote like naloxone for stimulant overdoses. So there could also be underreporting depending on how state and local officials are capturing that data. So here's my contact information. And again, the website, if you want some more information, is odmap.org. A ton of information on there to include training that's both ad hoc video, training manual, plenty of information. And if you ever need anything or want some more information, please don't hesitate to reach out. But thank you so much for joining, and thank you so much to NACCHO for the opportunity. And for this to be able to be virtual so that I'm still able to connect with so many of you. So thank you again.